Hi, I'm Greg with Blue Diesel Data Science, and I'd like to introduce you to our industry overview report. This report is comprised of national drug acquisition costs, FDA data, and Medicaid data. Let me introduce you to the report. Basically, the first panel up here is going to show you current and past price changes, wholesale changes in the market for a variety of drugs. This first panel only shows the current and past month. Down here is the average national drug acquisition cost per unit by NDC description, which means by drug. So this chart's very busy. It has too much data on it right now because we haven't filtered it. We can filter it by going up here and using any one of these four filters. Let's, for instance, say you're on a drug. Say you take Advair. You put Advair in here, and then you select the drug that you're on, like this. And what you'll notice right away is there have been no price changes in the past month. Down here, you can see the national drug acquisition costs over time starting in January 2014. So there have been small incremental increases in the drug price, one small decrease here. And down here, you can see by percentage the price increases. So you have a 6% increase, a 5% increase, a 4% over time. This starts back in January 2014. And at the bottom, you'll see all the price changes over time. So this is just a table of data that represents this chart up here. And over here, we have the Medicaid information. So you can see how many units were reimbursed in Medicaid, the number of prescriptions, the Medicaid amount or the non-Medicaid amount reimbursed, and then the total reimbursement. Let's navigate up here again. Let's deselect what we did before. Now we can either erase this like that, or a simpler way to do it is to hit the clear button just to make sure that we don't have anything selected. So there we go, and it will reload the report. These charts are all interactive, so if you want to select something here, it will subset down here, and you can see that this particular drug, atenolol, has really had not much price increase or price changes over time, except for basically 1018 this yesterday. And then over here, you can see the average price change. And of course, that reflects this chart up here. And over time, you're only really registering one large price increase. And here are the Medicaid reimbursements and number of prescriptions over time. There are some interesting things you can do with this report. For instance, if you know what your drug is, let's just say it's prednisone, you can look at all products at the same time. So there's a number of prednisone products in here. And you could see that in the current or past month, actually yesterday, there have been some price increases in prednisone. When you go down here, this chart's very interesting because there's a lot of people in this, there's a lot of drugs in this market that are represented in this chart. However, it's getting flattened because of one particular drug. If you look at the price, most of these are less than $1 a dose, but then you get down to Rayo's Dr. 5 milligram tablet, and that is $47 a dose. Well, the reason for that is a brand and not a generic. So you can basically decide not to select that generic or not to select that brand by selecting the generic indicator. And then it'll give you a better view of all of the drugs in the market without squishing the chart. There's lots of things you can do with this chart. If you click on it, you can export the data. You can see the data. So if you do this, it'll show you all the details that make up this chart. You can navigate back to the report, and then you can also hit this little button right here, focus mode, and that will give you a much bigger view of the chart if you want to investigate it further. You can go back like this. So once again, here's the rest of the report for that particular selection. So if we clear all our selections again, there's another fun thing to do is you can navigate down to this bottom chart, and you can, if you sort by average of percent change, you can see where there have been some significant wholesale pricing changes. Another thing that's interesting to do is you can sort by the new national drug acquisition per unit, just out of curiosity to see that there are some very expensive drug units prices in the market, like Stelara. is a very expensive drug. Neulasta is a very expensive drug. These drugs treat very serious conditions, and that's why they're so expensive. You can subset, again, any of these reports by just selecting them, and it will subset this report over here so you can see what the Medicaid total reimbursements are or anything like that in the report. I think that's enough to let you get started. If you have any questions, please reach out to Blue Diesel Data Science. And if you have any improvements or suggestions for improvements on the report, I'd love to hear them. And enjoy the report. Thanks.